Hey, so I wanted to do a video about bariatric vitamins and minerals after surgery. I feel like this is something I post the recommendations on, once a month or so, or send it out to somebody. But I wanted to kind of make a video out there as well because I think there's a lot of things that are a little tricky and it's difficult to type out necessarily. So I'm going to kind of give you the synopsis version today, and then I'm also going to try to put together a little table that will hopefully help you guys out. So one, bariatric multivitamin. The reason I recommend a bariatric multi is because it is specifically formulated for you from research that has been done that helps to show us what most bariatric patients require after surgery. Now, this is kind of a moving target as more research is done, and everyone's an individual. Everyone's bodies are slightly different. Some people don't need as much of certain things, but they need more of others. However, the bariatric multi is a really great starting point. And then if you are getting your labs done at least every year, hopefully, a little bit more, especially those first couple of years, and if you run into any issues getting it done more. But this is why it's really important to get your labs done regularly and to use a specific bariatric multi because it is formulated for you. The other thing, everybody always asks like capsules, chewables, if you're using a Flintstones gummy, no, that's not acceptable. But like a specific bariatric gummy, yes, you may be able to use. Now, I tend to recommend having a couple different varieties of a vitamin or different forms. So maybe having like a capsule or tablet, and then maybe also having some chewable varieties, or there are maybe a couple liquid varieties out there. But having a couple different options. One, because any of you that are post-op can attest to, there are certain days when a capsule is just too big and, too encompassing to take. There are other times when the thought of taking a flavored gummy makes you nauseous. And so having different options for sort of how your mood is that day can be really nice. That's the same reason I tell people if you buy a specific multivitamin or protein powder for that instance, and you don't like it or you don't tolerate it, just hold on to it. There's a really good chance that in a few months, it'll be just fine. And a lot of times, especially protein powders and vitamins, their expiration date is, a good year or so away. And so if you hold on to that, you just watch that expiration date, keep it, in a cool, dry place, it will probably stay okay and you'll be able to use it down the road. The other thing, calcium. So the calcium, I always recommend getting a calcium citrate. This is because you do not need the acid from your stomach to help it get absorbed. If you're taking a calcium carbonate, which is what a lot of just kind of generic calcium supplements are, because it's really cheap to make, that may not be as well absorbed, especially if you're taking it on an empty stomach. And guess what? After surgery, eating and then trying to take a large supplement like calcium can be really tricky. The other thing with calcium is I always get, this is a horse pill, and it is. Calcium is a big molecule, and so it's hard to kind of make it small, right? That's why it's always big and sort of chalky. So I, again, recommend doing the calcium citrate and having a couple different options for this. So maybe doing like a regular tablet, maybe doing a couple different varieties of chewables. I do a fruit chewable for my kids, like a fruit gummy. But then they've also started to get kind of sick of that because they're not milk drinkers. So I'm now trying to find kind of the caramel milk chocolate ones. But they also have a petite version, and I believe it's Citracal that has that. So again, looking for different options, different varieties, or different forms to take so that depending on what your mood is that day, what your tolerance is that day, you can find something that works for you. And also a lot of the calciums, they can be kind of like a little dessert almost. So especially some of the chewables, might be a nice little treat at the end of a meal or something. And then vitamin D. So a lot of times vitamin D will be included in your bariatric multivitamin. A lot of times it's also included in a calcium supplement. So the thing with vitamin D is that you just need to do a little bit of math and count up how much you're getting from the supplements that you're taking, whether it's your multivitamin and a calcium, or if you find a calcium that doesn't have any, just what you're getting from your bariatric multi. And then you want to make sure with your multi, is one serving 1 capsule, or is one serving 3 capsules or 5 chewables? You know, each one is a little bit different, so double check that. And then with the vitamin D, you want to look for a D3, and this is cholecalciferol. It's basically the form of vitamin D that is best absorbed. So most of them will say D3 on there. There's D2 and D3. You want the D3. The other thing is you need about 3,000 IUs or 75 micrograms. So 25 micrograms equals 1,000 international units when it comes to vitamin D. So just kind of keeping that in mind. Most things will have them labeled both ways, but it just kind of depends. You don't need to go super overboard for vitamin D, but you do want to get 3,000 international units or 75 micrograms daily. And again, getting that lab checked. Vitamin D is especially one that's common to be deficient in those that are obese, overweight, or have a history. So specifically for us, this is a big one to pay attention to. And then B12, usually, again, if you get a good bariatric multi, your B12 will be in that, and so you won't have to take an additional supplement. You want 350 to 500 micrograms. It'll be abbreviated as MCG on there. Again, this is a good vitamin that you want to have checked regularly as well. This is one that can commonly get high after surgery if people are really diligent about supplementing. There's not, if it gets too high, there can be issues. Usually it's not a big deal, but again, you want to get your labs checked regularly. You also don't want to be deficient in this one because it can lead to all sorts of neurological impairments, paralysis and whatnot. So we don't want that. And then finally, I'm trying to keep this quick, the patch. So again, I'm so sick of putting out this flyer, but I'll do it again. We do not recommend the patch. There's no personal vindicta against the patch people, but research so far is just not there showing us that this is a great way to get your nutrients in, right? We have a gut for a reason. We have evolved over thousands of years to absorb our nutrients from food. Hopefully this will be an option someday, but at this point, I don't know any dietitian or any bariatric surgeon that is recommending them. I don't want to say that outright, but I personally have not seen it. Again, hopefully someday, but right now that it's just not there. The other thing that's tricky about this is some people will say, well, I've been taking them for a year and my labs are all fine. I just got them done. And that's fine. A lot of these labs though, like lab work is not a perfect science, right? Medicine is not perfect. If you haven't learned that during a pandemic, we don't have everything figured out. And so, figuring out exactly which lab is best to check for certain deficiencies, we have a pretty good idea for most of them, but it's not an exact science. It's a moving target. It's more of an art. And so a lot of these labs and these nutrients, we haven't fully figured out how everything works together and why it works and what labs can really, show us what actually is going on or what's actually getting absorbed or not absorbed. Iron's a great example of that. There are, countless labs that we check to figure out what your iron status is. It's not just one simple lab. So just to keep that in mind, this is a process. If you have any questions, let me know in the comment section below. Like I said, I'm going to try to make that table up for you guys that will hopefully help people as well, and maybe will be something that you'll get in like a packet post-surgery. For those of you that have already had surgery, I'll just post it on here so you can download it or print it or just copy and paste it. All right, thanks guys.